under the tongue, and yeah, there has to be trust involved in that.
Mm.
Yeah.
You have to change the approach. It's
So
otherwise it's
for
not going to
parents,
work.
they have to be like more accommodating. They have to be more understanding, and don't expect your kids to be angels because we are not angels to start with, right?
Absolutely.
And I think one good point you touched about the youth, and if I bring an argument from the opposite side, most of the youth under peer pressure, or maybe just because got exposed, came in contact with new friends, or I just went to college, they might have tried some of the street drugs or illicit drugs just for the sake of recreational purpose. Let me try it and see how it works. And I wish, I mean, that was only limited to that point. But sometimes, I'm not saying all, but some they progress to the point of addiction, right? So, how we as medical professionals should deal with these two different scenarios, right? Yes, you did only for recreational purposes, or you do it occasionally, maybe like once in a few months. And I'm not trying to be kind of very judgmental about it. But if I see those symptoms as you described earlier,
Yeah.
now I have to be more concerned. Now I have to jump on things.
Yeah. So again, excellent question. I think at that point, what we should do is, for that particular situation, make sure that we talk to the kids about the enemy. Make sure that we empower them. We tell them that's how you recognize the enemy. That's how the enemy can come in, different colors and has different
Right.
skills and is going to tell you that, okay, yeah, no, no big deal. Just try that once. Shaitan, and again, that's I'm going into your, so that's of course you can address this part. But so Shaitan is just going to tell you once, take just one this baby step.
Mm.
It's not going to matter. That's okay. You're not going to get dependent. You're not going to abuse it in future. That's how it starts. Like almost all the patients in this age group that I see, they have almost all of them have started just like that. So it starts off like that, and then they know that, oh yeah, it's just recreational use, and they have not become dependent. Then comes the stage they have become dependent, and then they're getting to social and legal issues, and now they have a full-blown opioid use disorder or substance use disorder going on. So make sure that we talk to the patients, to our kids, that what, actually in this state this is legal, and but don't take it because that's what's going to happen. So show them the picture. How's that going to be 20 years from now? And that's actually, even I talk to the patients about it. The patients who have just become dependent on prescribed opioids, let's say, for example, they have never injected, they have never shot, in the arms,
Right.
drugs or heroin. I tell them, and they say, no, 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 doctor, absolutely, I'm not, never gonna do, I'm never, ever gonna. So I tell them, that's how it goes. So again, make sure that you do not underestimate the next step. So I would tell the kids that make sure, do not underestimate this step, that you might be thinking it's just one-time recreational use, but that's how it goes.
Yeah,
Mm.
no, definitely. And thank you so much for that. Imam Sajid, we
Um,
already,
yeah, I wanted to add, one thing I was thinking about was, if sorry, I didn't mean to cut you off.
please
So
go
you
ahead.
can ask a question, but I also think one thing parents can also do is what we fail to understand is Islam becomes a set of rules. It's what's not okay, what's not okay, what's not okay, what's not okay. That's what defines Islam. That perception is there, right? It's a very stringent religion. You have so many expectations. But rather, I think parents can approach it from an abundance mindset, right? Meaning that there's a principle, there's a maxim in Islam that says that everything is permissible until explicitly said otherwise. So the default ruling of everything is permissibility. I mean, there's an abundance mindset. This is not okay, but there's so many other options for you. There's so many other things you could do. I think that is something that parents kind of fail to maybe, or not, I'm not saying fail, but it was what we can kind of focus on when we talk to our kids about is that there's abundance mindset. There's so much you can do and so little that you shouldn't do.
Yeah, I think
Yeah.
it's most of the time overlooked in the other way around,
Yeah.
right?
Yeah.
So now you said like no, no, no.
Yeah.
It seems like there is so much vacuum, there's so much void. So if you are kind of stopping somebody from doing X, Y, and Z,
Exactly.
you have to fill that void with a lot of good.
Yes.
And fortunately, there is so much good, and which is so less talked about,
Exactly.
that we need to kind of emphasize more on that. And I think the youth, they are smart enough,
Mm-hmm.
and it's just they need the right direction and some guidance with patience. That's
Mm-hmm.
what I feel like.
Yeah.
And I mean, that leads me to my next question, right? we as a society, I mean, we are currently facing immense problems. If you talk about like mental health, right, there's
Mm-hmm.
so many issues. And even as adults, we are kind of having a lot of challenges in recent times. We talk about depression, anxiety,
Mm,
suicides like X, Y, and Z, family issues, single parents, right?
mm,
Family conflicts. So everything now, a youth, a young boy is growing in that family, or maybe just a single parent who is busy at work trying to make the ends meet.
mm-hmm,
Now there is less supervision on him or her.
mm,
So how these challenges from the previous generation impacting the youth, because there is, it's not their fault
mm-hmm,
that, and they are not coming with, they're coming with a baggage actually, right?
mm-hmm.
So what we have to do as a preventative measure, as a parent, as a responsible parent, dealing with our own challenges, so we don't pass on those problems.
Yeah. I mean, I know back home we used to have a saying, and we all grew up kind of hearing this, probably it takes a village to raise a child, right? There was a village that raised a child back home, right? There was no, I mean, my father used to say, if we did something, even the neighbor had the right to kind of reprimand
Mm.
us, or we would hide from the neighbors. Forget our parents,
For
even
sure.
from the neighbors, we'd hide.
Yeah.
That's not happening nowadays. It's
Mm.
there's no village concept anymore. In fact, that's kind of deteriorated to like a single parent, as you
Mm.
mentioned. Um, so it does take a lot more. It takes beyond just the single parent or the parents that to raise a child. It's like the family environment. As we become isolated as communities and families now, it's gotten more challenging to raise and so that's why I think the masajid have to be more robust spaces than just a prayer space. The human element, the organic element, the concept of sohbah, the companions were called the Sahaba for a reason. It was the companionship of the Prophet ﷺ. Once we regain that kind of that societal thing, right? Coming to the masjid, praying in a community setting 5 times a day. That's unheard of in any tradition. And so that has its benefits when you're interacting. We're social creatures. And
Right.
so when that is isolation, that's taken away from us, that's going to bring about very bad things, right? Isolation and being alone. And that's why the Prophet ﷺ said, don't, if you're alone, the second is going to be, your companion is going to become shaitan in your nafs, right? That's when he's going to come in and impact you. And so I think as a community as families, we need to start utilizing resources in our places of worship. Masajid can become more robust spaces. And most predominantly masajid are, other than the five salah, they're kind of empty. That Fajr, Dhuhr period, they're not isolated. And alhamdulillah, Dallas is a better community. We have a lot more resources, alhamdulillah. We've kind of come a long ways versus other communities. So we're grateful for that, alhamdulillah. But I think that kind of that anecdote, right, that saying of it takes a village to raise a child, it's not the parents have to understand that yes, you build that relationship, but use the resources around you, and communities need to kind of
Got
formulate
it.
around that. I
And
think that would
probably
be,
that's why we call as community centers instead of just
yeah,
masjids, right?
yeah,
So where you come not only just for the prayer, but all for your social needs.
yeah,
And again, if the society is open and receptive, we also have to kind of let them in because now we are kind of closing up our spaces, right? So this is my personal space. Nobody has
yeah,
right to
yeah,
intervene, and probably have gone to extreme and that now is getting counterproductive for
yeah,
us. And sometimes, I mean, you don't have 24 hours to watch your kid, and
yeah,
you have your own job, you have
yeah,
your own a number of things in your life. So sometimes, as you said, if there's neighbors, community
yeah,
who are definitely kind of well-wishers
yeah,
for you, if they are involved getting the feedback, there is I would say not a concept of fear, but at least a concept of supervision
yeah.
by the relatives, by the neighbors, that sometimes keep the kids in check.
Yeah, I mean, even the Sahaba, like Anas ibn Malik radiallahu anhu, and many, they would say that we would, our mothers would send us to kind of, in the hadith it mentions, serve the Prophet, meaning like they would run little chores, errands, but essentially it was just spend time with the Prophet, right? It was
Exactly.
young children that would just kind of hang around the Prophet, and they would say like, I mean, for a child, right? It's very hard to articulate. I mean, it's not hard. They're more challenged with it than an adult, right? To
Exactly.
articulate how they feel. But when they do articulate, they really noticed that they felt it. And they would say what? That he never told us, why didn't you do this? Why'd you do that? The
Yeah.
Prophet never said that to us. He wasn't critical. But then, one companion mentioned he was a young child. He said, I was a child. I was eating with the Prophet in the same plate. and Rasul didn't. He said I was snatching from all parts of the plate, right? And so he goes, and Rasul said, eat from what is in front of you and say Bismillah. He didn't say don't do this. He didn't reprimand him. He just advised him like eat from what's in front of you and say Bismillah before you eat, right? He taught him, right? It was modeling, it was teaching, it wasn't reprimanding. It was beautiful, and I feel like those are powerful. And often we'd read a hadith and it feels good, sounds good, but if we kind of begin to kind of peel the layers back of why the Prophet ﷺ did certain things and the way he did it and what's recorded, it's very profound. It's very impactful, I think.
And definitely, especially in this scenario, it makes more sense.
Yeah.
Dr. Khan, coming back to probably one of the important questions is the treatment, right? Now we have recognized the problem, the issues surrounding the problem, and what role society can play. But I think the more important thing is like once somebody has gone to an extent that he needs medical intervention or medical help, how do you start? I mean, is it, I think, I'm sure there is, depending on the scenarios, right? Right off the bat, jump on the medication treatment, or do you give time for counseling, involve the family, involve the community, make sure like what's going on to understand more about the patient before prescribing a medication?
So again, ASAM has the criteria for that, American Society of Addiction Medicine. So prevention, that's prevention is better than the
The best
treatment,
thing,
right?
yeah.
As they exactly always say. And again, as actually I was touch base a little bit on the last question as well, or maybe comment on that it should be as we, as fellow physician, you can totally understand, we talk about multidisciplinary approach, which works the best for the patient, right? So it should be, we should apply the same principles in this case. Let's say, our kids are going to the mosque and, Islamic center, and alhamdulillah, they should have the gym and all that, channel the energy, they should be really busy in that. By the way, that increases your serotonin quite a bit. That brings down your anxiety level quite a bit. So even when in opioid use disorder, I see that marijuana, again, that question is kind of related. What's the reason that they of course, they can come up with the recreational use, but sometimes they're trying to decrease the anxiety. I've not seen a single patient of marijuana dependency who did not have any issues with anxiety. They almost all the time,
So there
they
is
have.
there is underlying psychiatric
Exactly.
disorder.
So they have underlying generalized anxiety disorder or social performance, disorder issues. So you have to treat the anxiety part of that as well. And again, that can be dealt with at the prevention level. Let's say that if they're really involved at youth level, let's say Sunday school, activities at the Islamic Center, at school, at every single level they're involved in that. They're channeling their energy, and at the same time, they're not they're really doing good with the peers as well. There's no social pressure. Again, as you mentioned about the village concept. By the way, our neighbors definitely did some corrections. I actually still remember that. We were playing outside, on the street, and I remembered one of the neighbors, "What's going on? It's Maghrib time. Come on!" And we're like, "Oh yes, yes, of course, yeah, yeah." So I remember, like, they had full rights. They had full rights. So that definitely works. Yeah. So again, coming back to the treatment. So if the underlying disorder you're dealing with, let's say generalized anxiety disorder, like I've dealt with some patients with marijuana dependency, you treat the generalized anxiety disorder, and they did really, really good. They did really good afterwards. However, sometimes if it starts with the recreational use and that becomes as an excuse, so you have to make sure, they're not just using the rationalization, which is you do something bad and you come up with a reason after you do something bad. So you're not just using the rationalization. You're doing it because of a bad, with a bad intention. So again, if it becomes a substance use disorder, patient meets the clinical criteria. Let's say that we are in touch with the Islamic Center as well, the mosque as well, and our imams. They have done all their part, and they think that, okay, what, this has gone beyond that, and the person is getting into social and legal issues. For sure, at that point they would need treatment. But if it's like if the patient is at a recreational use level, significant counseling. Again, before that, prevention level. Unfortunately, let me just add that I think 5 6 years, maybe 5 years ago, I sent an email to Wiley High School, and that's that involved the principal, vice principal, social worker. I think there were 7 people that I can offer free lectures. Again, my intention is not to treat, but to Just
Prevent.
exactly. So I want to work at the prevention level. I didn't get any reply. So again, there are biases in all at every level. We have certain level of prejudice, stigma around it. If you don't accept it as a fact, there's a big problem out there. The problem's not going to go away. There is a big problem out there, right? So coming back to the treatment, so if the patient does meet the criteria, the treatment is actually, we call it medication assisted treatment. That works the best with the counseling. So one third part is the medication assisted treatment. And I'll briefly touch base on that. The second part is actually aggressive counseling. The third part is the social environment, the situation, So
Mm-hmm.
again, unfortunately, single parent family, other social situations, if they have a significant role in that, we have to make sure that that gets addressed as well. So, but yeah, one third role is medication assisted treatment. As we know, with nicotine dependence, you do the medication assisted treatment plus the counseling that works the best. Same thing, substance use disorder. And actually, ASAM typically calls medication assisted treatment for opioid use disorder. So we actually use Schedule 3 buprenorphine. It's a partial opioid. It replaces the full opioid. So are we replacing one thing with another? Yes, we are. Is this going to cause dependency? Yes. Then why are we doing it? Because for the time being, we use medication-assisted treatment, maybe for 3 to 4 months, and then we wean them off buprenorphine as well, so they're no longer dependent on anything. So is that gonna give them high feeling? No, because it's a partial opioid. So the terminal effect is actually weak, but the affinity to the mu receptors, those are the same receptors that the full opioid actually bind. So the affinity is so strong that when you have taken buprenorphine, although the final effect is weak, so you're not getting high, but you're not having any cravings, and it definitely treats the withdrawal symptoms quite a bit. That even on the top of that, when the patient takes opioids, it doesn't work. Again, it's research back that years ago, almost 20 years ago, when they did the study, you can still do it going cold turkey. You don't take any medication. I mean, you don't take any opioid. You stop taking opioids, you're going to have like really bad withdrawal and cravings and whatnot. Let's say that you do pretty good. According to the study 20 years ago, 10% chance. And then, but there's a 10% chance of death from opioid overdose as well. Again, as I mentioned,
And
that
that's significantly high.
that's very high. Exactly, 10% is very high. That's why you see, maybe sometimes on Twitter, the celebrities are saying, okay, well, okay, week one going really good and sober, this and that, this and that. Unfortunately, then you hear about even athletes, even national champions. We heard about that news, right?
Right, right.
And the celebrities, and all of a sudden, okay, overdose. So they're not in a lot of times. Again, there's no tolerance. They take the same dose, even less. That's what happens. According to the newer study, there's only about 3% chance. And actually, even that study was done, around 2016. So with the fentanyl on the rise, I'm pretty sure that the numbers are going to be much more worse.
Got it.
So
So,
in short, yeah, 3 month, 4 month treatment, and that depends. That's the outpatient treatment. ASAM has different criteria, of course. Prevention, it's at different dimensions, and then outpatient, intensive outpatient, your partial hospitalization, inpatient, or intensive inpatient.
yeah, no, thank you. Thank you for the detailed answer. I think the whole concept is revolving around kind of weaning off slowly, as you started earlier in the beginning, right? So kind of like having cold turkey is kind of possibly gives worse outcomes of relapse, of getting worse of the existing condition. So thank you for that. And you touch base upon the role models like athletes, Bollywood stars. I think youth is also kind of getting affected somehow because they consider them as a role models. And if they're abusing drugs, then it's okay for me to abuse drugs. Again, that's not a justification. But unfortunately, we live in a society. Uh, Coming back to you, Imam Sajid. So yes, one third is a medication part, but still two third is an open field. So does Islam offer like any structure of kind of rehab or any concept of rehab in Islam? How if somebody is addicted, let's not take the name of a drug, right? Let's say that addiction to an illicit substance, it could be alcohol, it could be any other drug. So is there like a structured program that, yes, assimilating back into society, giving them the support that will complement that medication or the medical treatment?
Yes, there traditionally, like throughout our kind of history of scholarship, there was these concepts of you would have, I would say, like, when we have this concept of like tasawwuf as well, right? This you kind of spiritual rectification, the spiritual journey, right? You have these places where you kind of would escape for short periods of time, right? 40 days, you go into this like space of spiritual rejuvenation. I mean, I know scholars would use that, and they would kind of, people would come with all kinds of, Sheikh Ashraf Thanwi, rahmatullahi alayhi, I mean, Sheikh Yunus Patel in South Africa, when I was there, he was very effective with the community that was suffering from addictions, drug addictions in particular. So what he would, I mean, they would take them out, the change of scenery, right? So it was almost like a rehab facility, but it was like there was a lot of influx of spirituality as well, right? So they're kind of replacing that with something. They're creating the awareness of Allah. They're kind of filling that void perhaps that they may feel, the reason why they're having substance abuse. And so removing them that from that environment, right? That sohbah, right? That companionship, and putting them into a really healthy environment where people are aware of these things, the harms of these drugs and addictions. And so kind of changing that environment for them, that was something that
Right.
scholars in our tradition actually utilized, and it was very intentional about it. Hakim Akhtar Saab from Pakistan, he used to work with a lot of rehab people, addicts, and he would say, and they would employ the weaning off process themselves, right? So they would say, he had a medical background as well, but he would say, like, he would wean people off, and people were like, "What are you doing? I take, how many times do you take this drug? I take it 4 times a day. Why don't you try it 3 times, and then
Right. So
maybe two
kind of
times?"
weaning slowly
So weaning
off.
them off.
Yeah,
And so I think, yes, tradition and scholarship has kind of dealt with this in the past, and even the Prophet's time, there was companionship, there was companions that it was time in companionship, right? In changing that environment that I think our tradition does offer, and being aware of filling the need for that with the awareness of the spiritual self in Allah subhanahu wa ta'ala. You see poets often write about like spirituality as being intoxicating, right? They talk about it, right? Being in the dhikr of Allah, the remembrance of Allah, reading the Quran, it's very intoxicating, right? They say it maybe appropriately, inappropriately, I don't know, but it has that soothing effect, right? And so when you fill that with something that is healthy, that is good, I think that is something that is good. And even nowadays, I always tell people, like, I think we've shifted from, we usually sometimes as a community we become very reactionary, and we go from one extreme to other extremes. We became, nothing was mental health, right? It was all, you're a bad Muslim, you don't make a du'as and you don't pray. And then we went to one extreme, and I feel like there's a healthy middle ground where I think mental health matters, I think spirituality matters, as well as like the physical being, right? I feel like the body, we've kind of impacted the body, and suppressed these spiritual, physical, and mental needs that the body needs. And I think
definitely, definitely.
if there's a proper balance of both, I think that people can be very robust individuals.
And definitely. I mean, you mentioned some great points, right? Kind of disassociating from the existing environment, which is toxic, to a completely different environment, which
Yep.
is definitely you're refueling them with a lot of spirituality. So at least they get detached from the environment they're
Yeah,
coming
the
from.
environment has to change. There's a theory written, it's called the family systems theory, right? Where he's, in the hospital setting, that you work in the ER, you work in the hospital, it's a lot of relapse, right? So even like suicide ideations, you have patients that are like, "Oh, this is my fifth attempt." You're like, 5 times attempt on your life, a 12-year-old, a 15-year-old, like, why is this happening? Is because the environment hasn't changed. They go to this rehabilitation, they start getting improving, they start healing, and then they go right back into that environment, and then they repeat that behavior.
Definitely. So there is no disconnect.
Yeah.
And coming back to one of my last questions, Dr. Khan, is about the relapse, right? So yes, you have worked on a patient, kind of got him kind of from addiction. Now he has been sober for a while, then he relapsed. So not talking about the judgment part of it, right? How likely is somebody to relapse if someone was addicted in the past? Or is it dependent on an individual or the support system or the family system, what Imam has mentioned? And how important is the peer pressure or the company? And I mean, once you get out of it, is it time to change your friends? Is it time to change your company? And now we live in the day and age of social media, right? So everything is accessible at your fingertips. So is it playing a good role, bad role? Like, what's your take on it?
Excellent question, and Jazakallah khair for that question. I always tell the patients, this medication-assisted treatment, which is one third part of the treatment, it's not going to treat your company. So as soon as the second or the first follow-up visit, actually, which is the second visit, I start talking about it, about possible relapse. And it might seem counterintuitive, but actually it works because this is the empowerment. You're telling them, this is part of the cognitive behavioral therapy as well, that you're telling them about all the triggers and risks and how to avoid. And that will be my message to the youth as well. First, work on the prevention part, how to avoid, how to avoid. If it does happen, then how to evade the whole situation, And that is true for a patient who has been in the medication assisted treatment program. Let's say that we treated the withdrawal symptoms and whatnot
Right.
with buprenorphine, medication assisted treatment, wean them off as well. And then during that phase, I tell them, again, social environment, extremely important, counseling, extremely important. So even for our non-Muslim viewers, I highly recommend them. Let's say, for example, I see most of the time, again, it has certain association with the age group as well, because as I mentioned, nothing against that age group. We all have been in that age group, but it is what it is. You can't look into the future, and you think that you're super smart. Again, I'm not having prejudice against that age group, but when I talk about it, that's how they get empowered about it. Okay, yeah, we'll be more careful. That company, number one reason for relapse is actually bad company. So they might be in touch with their old friends after 3 months or 4 months or 5 months. And if they have been weaned off the medication assisted treatment as well, and you have no protection, that's the most important risk for them. So for our non-Muslim viewers, I would actually say that I tell it to discuss with the patients as well in their like mid-20s as well. Hey, get married, have a family, have a stable job. This has a huge impact. When you're a dad, when you have kids, you're not just thinking about yourself. You're thinking about long-term goals. You're thinking about how's your son, daughter gonna, look at you, and
Now you
you
have
want to
more
be role model.
responsibility, right?
Exactly.
So,
You want to be role model for your wife, for your kids. So that has a huge impact. So my patients who actually have been really, really successful. Just to give you an idea, again, we're not biased, but this is the data that I'm going to share will help the other patients as well. That the best outcome is for the patients who are in their like mid 30s, late 30s. They're married, they have kids, they have stable job, and the history was less than 5 years. They have not had any IV drug use. And even when they used fentanyl, it was for a short period of time. Again, I'm not saying that you will have bad luck if you don't fulfill that criteria, but I'm just saying that basically you have more, like additional risk factors. Let's say that you're in that age group, 19, 20, 22 year. So yes, because of that issue, um, you know, yeah, maybe if you're smart and you're married, you have a job, good social situation, and you think that, what, I would be absolutely stay away from IV drug use, I would absolutely stay away from fentanyl, then yeah, you have great prognosis. If those patients do end up relapsing, depending upon what is the definition of relapse according to them, because sometimes they think, for example, let's say a patient, and Jazakallah khair, Mamadeen, for that. You mentioned that one thing at a time. That's exactly what we do. And So let's say, for example, as you mentioned, Dr. Muhammad, that you see the patient in the ER and everything is positive, like, methamphetamine, marijuana positive, and, oxycodone positive, and benzo positive, and whatnot. So that's poly drug use. What you're going to do, address one by one. So let's say that you have dealt with opioid use disorder and the patient has not relapsed on opioids. That's great. I would actually commend the patient on that. And then maybe the patient relapsed on something else, and depending upon which substance the patient relapsed on, you can go ahead with the treatment. Again, counseling has a huge, huge, huge role in that. But if the patient unfortunately relapsed on full opioids and went into the whole, yeah, then the treatment has to be started. Like he has to go through the induction and the maintenance phase as well.
Definitely. So,
Yeah.
if I may add, I think the best thing to get addicted to is the success in life, right? The milestones in life, like getting married, having a great job, you know, bring up a successful generation for your future, right? So, probably I think we should focus on getting high on something else instead of something that's destroying your health. And my last question to you, Imam Sajid, is how this addiction or this issue of addiction impacting the relationship with the families, right? So if a youth has gone through this,
Hmm.
he might have relapsed, he might not have relapsed, but there has been a strained relationship with the families. It's impacting their career because it's a prime time in their life, and that time has been wasted in the treatment and going through all that. That has impacted their IQ, as doctor has mentioned. So, how do you think, or like from a high level, how do you look at the society that this is impacting and it's impacting the future of a society, of a country?
Hmm. Uh, yes, I mean I think that's a very heavy and broad question. Is like how does it impact society? It's definitely impacting the society, right? We see it. It hinders career choices, life journey, all of that for children. So I think prevention, as Dr. Han mentioned, is that like prevention is something that we need to start early, right? I would say parents need to start having these conversations at a younger age with their children and have those and allow that conversation and right and again, when you create this, it's not all about limitations. We're just not, my parents aren't just limiting my life, but no, there's an abundance mindset. Like, hey, you can do this, but we're not gonna, this is something, but clear and firm boundaries, right? So where
Right.
they, and then you're obviously, the same time, you're modeling that behavior as well. I think that societally, that's something that we need to start really waking up to and start doing and be very intentional about it, right? I think I mean, Islam is the first hadith, and if you look at most hadith books, is about intention. Yeah, it's a very important component of our tradition. Everything is built on intention,
Definitely,
right?
definitely.
Everything is built on so intentionality, right? I'm going to be intentional about these things as a community because oftentimes it's like that, the the we have this coverage over our eyes. It's we don't know what's going on, and I think it's imperative that parents speak about this and they take preventative measures and try to become that village or provide that village for the child and um, have these conversations, have the abundance mindset that like no, Islam allows so much, it prohibits so little, and that perception when that shifts, then we will find healthier, better avenues. And I think people find that the betterment in their life from that, right? But also, yes, like you said, there's people that are doing that now, and they're engaged in their IQs. They're affected by the impact. They're kind of their careers or their education or their family lives are kind of uh, delayed,
It's
at
taking a
least. Or,
hit.
yeah, it takes a hit, and
Yeah,
it
definitely.
takes the impact.
No, I think that's a great point that you have mentioned, that if you're more involved as a parent right from the
Yeah,
beginning,
yeah,
that will definitely have a better outcome.
yeah.
Your last point, Dr. Khan.
Yes, Dr. Mohammed, absolutely. I would like to touch on that
Yes.
topic as well. That so substance use disorder, it can definitely cause anxiety, significant depression, same signs, symptoms of ADHD, like attention deficit hyperactivity disorder. So you can have inattention, hyperactivity, loss of memory, anhedonia. You can become emotionless. You're less and less involved with your family, with the community. So it has a huge impact, and we shouldn't ignore that. When the patient goes into treatment, actually, and the patients say that they usually ask, okay, so how's that going to be? How are we going to feel? And I tell them, normal. That's what you have been missing.
Mm-hmm.
And they are really happy when they go back to feeling normal because, they have been in the false perception.
Yeah.
Again, we have to remember, the whole axis that this has to deal with dopamine. That's acute pleasure you goes up and down, and afterwards it leads to depression, and you have
Right.
the feeling of guilt and whatnot afterwards. And what we are looking for is long-term happiness, and you're not going to find long-term happiness in substance use disorder. So when the patient gets better and better, all the emotions come back, and they feel again normal, and and I feel like, that's the most important thing for the patient. That's kind of like a gift to them, when they go through the treatment, and that's what we need, in our community. So it's extremely important for us to understand that it's not giving something back to the patient, it's taking a lot of things away from the patient.
I think that's a beautiful point. And I think the most important thing is to, as you said, feel normal, right? I think I have learned so much today. It's a great discussion for me and eye-opening. I hope it helps a lot to our viewers who is watching. And definitely, I want to thank them for their time. And if they need any help, then definitely we have a lot of resources in the community. Just have that willingness to reach out. Thank you both so much for the time today, and hopeful to look forward in future
Yes.
on
Jazakallah
Doctor's
khair for
Couch.
Thank
having
you so
us.
much. Jazakallah
Thank
khair.
you.
Thank you for the opportunity.